Hello.
Hello.
My name's Grace. I'm going to be your nurse today. How are you?
Good, how are you?
Good. What would you like to be called today?
Heather.
Okay, Heather. So what I'm going to be doing today is a head-to-toe physical assessment. It's kind of a lengthy assessment, so do you need to empty your bladder or anything before we get started?
No, ma'am.
Okay. So, what is your name?
Heather.
And where are you at?
Union Temple Road.
And what day is it?
Sunday.
And what time of day is it?
Afternoon.
Okay. If there was blue lights behind you, what would you do?
Turn on my blinkers, slow down, and pull off the side of the road.
Okay. So her overall appearance, she appears to be well groomed. Her posture is erect. She is able to answer questions appropriately. She is alert, oriented to person, place, and time. Her judgment is intact. So we're going to go ahead and move on to the physical exam portion. I'm going to start with your head.
Okay.
So I'm going to go ahead and feel your scalp. How many pain or tendernesses
No.
palpating? Okay. So her hair is symmetric and evenly distributed. No balding spots. No lesions or masses noted with palpation of the scalp. Next I'm going to move on to her eyes. So her eyelids are pink to light tan. Her eyelashes are intact and evenly distributed and pointing upward. Her sclera is white. I'm going to pull down on your eyelids, okay? Her conjunctiva is pink and moist. I'm going to go ahead and check your vision.
Okay.
So we're going to hold this about a foot away from you and cover one eye. So we're going to check your left eye.
428739.
Okay. And 20/20 vision in the right eye. And the left eye.
428739.
Okay. And 20/20 vision in the left eye. So I'm going to go ahead and check your pupil size. Her pupils are about a 4 millimeter bilaterally and they are round. So I'm going to go ahead now and just make sure your pupils are reacting to light. Okay?
Okay.
So direct and consensual response is intact. So her pupils are equal, round, reactive to light, and next we're going to check on her accommodation. So I just want you to look at the wall and then my finger, okay?
Okay.
And her eyes, her accommodation is intact as well. Now I'm going to go ahead and check your red reflex.
Okay.
So I'm just going to be checking into your pupil. Okay. And red reflex intact. And red reflex is intact. Do you have any problems with your eyes?
No.
Okay. So next, I'm going to go ahead and palpate your sinuses.
Okay.
Let me know if you have any pain or tenderness. Is your frontal and your maxillary? Any pain or tenderness?
No.
Okay. No pain or tenderness or masses noted with sinuses. Next, we are going to move on to your nose.
Okay.
So your nose appears symmetric. Excuse me. I'm going ahead and cover one nostril and breathe in. And cover the other nostril and breathe in. Okay, her nostrils appear to be patent. Did you have any problems with that?
No, ma'am.
Okay. I'm going to go ahead and look up into your nose and check your nasal mucosa.
Okay.
Okay, nasal mucosa is pink and moist. The turbinates are present, and no septum deviation noted. Do you have any problems with your nose?
No.
Okay. Next, we're going to go ahead and I'm going to palpate your ears and let me know if you have any pain or tenderness.
Okay. No pain or tenderness.
Okay, so no pain or tenderness noted with the pinna, the tragus, or the mastoid. Next, I'm going to go ahead and examine the inside of your ear, okay?
Okay.
So I'm going to pull your ear up and back. Okay, her ear canal is clear, and her tympanic membrane is intact with a pearly gray and white color. I'm going to go ahead and check the other ear. Okay, up and back. Move your hair.
No, you're fine.
Okay, and this ear canal is clear as well, and the tympanic membrane is intact and pearly gray and white in color. Do you have any pain or tenderness when I did that?
No, ma'am.
Okay. Next, we're going to go ahead and move to your mouth.
Okay.
So her lips are pink in color and dry. There's no obvious cracks or lesions. I'm going to go ahead and have you open up your mouth. Okay. The oral mucosa is pink and moist. Hard and soft palates are intact. She has no tonsils. Uvula is present. Her teeth are intact. Do you have any pain or tenderness with your mouth?
No.
Okay. I'm going to go ahead and palpate your trachea.
Okay.
So just let me know if you have any pain or tenderness, okay?
Okay.
Any pain or tenderness?
No.
Okay. Her trachea appears to be midline with no deviations, and she has no pain or tenderness noted. I'm going to go ahead and check your thyroid.
Okay.
So I'm going to have you take a drink, and I'm just going to feel for your thyroid, okay? Okay. Her thyroid is capable of one swallow. Did you have any pain or tenderness with that?
No.
There are no noted masses. Next, I'm going to go ahead and feel your carotid pulse.
Okay.
So 2+ amplitude with an even rhythm. So your other side. And 2+ amplitude with an even rhythm. Next, I'm going to go ahead and feel of your lymph nodes. So I'm just going to be palpating across your face and your shoulders and under your arms. And you can just let me know if you have any pain or tenderness, okay?
Okay.
So we got preauricular, postauricular, occipital, posterior cervical, deep cervical, superficial cervical, tonsillar, submental, or submandibular, and submental. You'll shrug your shoulders for me. Supraclavicular, and now you relax. Infraclavicular, and then if you lift up this arm for me, do lateral, central, subscapular, and pectoral. Lateral, central, subscapular, and pectoral. Did you have any pain or tenderness with any of that?
No.
Okay, so there was no pain or tenderness known with the lymph nodes, and they were non-palpable. Next, I'm going to move to your arms.
Okay.
So I'm going to go ahead, and her arms are light tan to pink in color and warm and dry. There's no edema noted. I'm going to go ahead and check your pulses. So brachial pulses are 2+ amplitude with an even rhythm bilaterally. And a radial pulse. 2+ amplitude with an even rhythm bilaterally. Her fingernails with capillary refill less than 3 seconds. Her nails appear to be about 60 degrees with no clubbing noted. Have any pain or tenderness with your arms?
No.
Okay. So I'm going to go ahead and move you back.
Okay.
So her skin is warm and dry and light tan to pink in color. I'm just going to go ahead and feel your spine and your muscles here, okay?
Okay.
The spinal processes appear with no deviations and the muscles. So I'm going to go ahead and feel while you're breathing in and out. Chest expansion is symmetric. I'm going to go ahead and percuss, and I'm just listening for any dull areas, okay?
Okay.
Okay. No dullness noted with percussion. I'm going to go ahead and listen to your lung sounds now, so just take some deep breaths as I listen, okay?
Okay.
Okay. And lung sounds are clear in all lobes posteriorly. I'm going to go ahead and palpate for any tenderness in your CVA.
Okay.
So I'm going to be palpating right here and just let me know if you have any pain or tenderness, okay? Or not palpating, percussing, I'm sorry.
Here. No pain or tenderness.
Okay, and no CVA pain or tenderness noted. So now I'm going to move to your anterior chest. So again, I'm just going to be looking at your skin. It's light tan and pink, warm and dry. Chest again appears symmetric. I'm going to go ahead and listen to your lung sounds.
Okay.
And while I'm listening, I'm going to go ahead and listen to, for root and your carotid pulses.
Okay.
Sorry about that.
You're fine.
And there's no root noted bilaterally with the carotid pulses. The lung sounds are clear in all fields on the anterior chest. After that, I'm going to go ahead and listen to your heart sounds.
Okay.
So we're going to start with the aortic on the right second intercostal space, the left second intercostal space for the pulmonic, the third left intercostal space for the Erb's point, the tricuspid, the fourth left intercostal space, and the mitral at the fifth. I'm going to go ahead and listen to your, or count your, listen for your heart.
Okay.
Okay. Heart rate is 71. Your rate is even. S1 and S2 audible, no murmurs noted. next, I'm going to go ahead and have you lay back for me. We're going to move on to your abdomen.
Okay.
Are you comfortable? Here, wait. Go off for me, I'm sorry.
But you're fine.
Alright, if you'll just raise your feet up just a little bit for me. I'm going to go ahead and lift your gown up while we keep your legs covered up. Excuse me. Okay. So, we'll go ahead and we'll start looking at your abdomen. So your skin is again light tan to pink and warm and dry. Your abdomen is flat and non-distended. I'm going to go ahead and listen to your back sounds.
Okay.
Okay. Bath sounds are present in all 4 quadrants, and I'm going to go ahead and listen to your aorta, your renal, and your femoral arteries, okay?
Okay.
And there are no roots present. I'm going to go ahead and feel for any pulsation. There are no pulsations. Go ahead and percuss your abdomen. I'm just again listening for any dull areas.
Okay.
No dullness noted with percussion. Now I'm going to go ahead and palpate your abdomen.
Okay.
So I'm just going to, first I'm going to be doing some light touches, and I just want you to let me know if you have any pain or tenderness, okay?
Okay.
Any pain or tenderness of that?
No.
Okay, now I'm going to go back and I'm going to do the same thing, only I'm going to push a little harder, okay?
Okay.
Any pain or tenderness noted?
No.
Okay. Now I'm going to go ahead and check for rebound tenderness. So what I'm going to do is I'm going to push down in the middle of your abdomen and lift up, and you can let me know if you have any pain pressing or lifting, okay?
Okay.
Any pain? No. Okay. No pain or tenderness noted with rebound check. Now I'm going to go ahead and palpate your liver. Okay. And the liver is palpable at the right costal space with no masses noted. Are you having any pain or tenderness with any of this?
No.
Okay. I'm going to go ahead and put my hand in the sheet and feel your femoral pulses, okay?
Okay.
2 plus amplitude with an even rhythm. 2 plus amplitude with an even rhythm. While you're in this position, I'm going to go ahead and have you lift your head up just a little bit. Okay. And there's no hernias present. Okay. From here, I'm going to let you sit back up for me. Well, yeah, you can go ahead and sit up. And then I'm going to look at your lower extremities, okay?
Okay.
Make sure you're covered here. Alright. So, go ahead and look at your lower extremities here. And her skin is light pink, or light tan to pink, and her warm and dry. She has no edema noted. I'm going to go ahead and palpate your pulses here.
Okay.
Your posterior tibial. 2 plus amplitude with an even rhythm. And your dorsalis pedis with a 2 plus amplitude and an even rhythm. Capillary refill is less than 3 seconds. Do you have any pain or tenderness noted in your legs?
No.
Okay. Cover you back up. Okay. From there, we're going to go ahead and we're going to move on to your cranial nerves. So the first one we're going to assess is your olfactory, and that's for your sense. So
Okay.
I'm going to have you close your eyes and cover one nostril and let me know what you smell.
Garlic.
Okay. Excuse me. Excuse me again. Okay. Okay, so cranial nerve number 1, the olfactory, is intact. Next, we're gonna do cranial number 2, and that's your optic. So what I'm gonna do is I'm just gonna put my hands behind you and start moving forward, and let me know when you see them.
Okay. I see them. I see them. I see them.
Okay, cranial number 2 is intact. Next, we're gonna be checking 3, 4, and 6. That's your oculomotor, your trochlear, and your abducens. So what I'm going to be doing is just checking for your eye movements. So I'm going to have you follow my finger with just your eyes, okay?
Okay.
And hold it. Okay. So there was no extra eye movements followed with the glazes or with holding. No nostalgia noted. So next thing I'm going to do is I'm just going to
Don't fall.
fall over. I'm going to do the cover and uncover test, and I'm just going to be looking at your eyes, okay?
Okay.
Okay. There was no extra eye movements and or unilateral eye movements. Cranial number 3, 4, and 6 are intact. Next, we're going to move to cranial nerve number 5, the trigeminal. And what I'm going to be doing is having you clench your jaws and just feel, okay? So, muscle tone is firm. And then what I'm going to be doing is checking your light and your sharp and dull touch for sensation. So this is going to be dull, and this is going to be sharp.
Okay.
Can you close your eyes for me?
Mm-hmm. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp.
Okay. So cranial nerve number 5 is intact. So next we're going to move to cranial nerve number 7, the facial nerve. So I'm just going to be checking your facial expressions.
Okay.
So can you smile for me? And frown for me? And be excited. Okay. So cranial nerve number 7 is intact. 8 is going to be your auditory cranial nerve. So what I'm going to be doing is I'm taking this tuning fork and I'm going to strike it and put it on the top of your head. And let me know that you can hear it in both ears, or if you cannot.
Okay.
And then let me know when you can no longer hear it, okay?
Okay. I hear it in both ears.
Okay. And let me know when it stops.
It stopped.
Okay. Next, I'm going to be striking again, putting it on your mastoid process. Let me know when you can't hear it anymore. You're going to do it like this, and let me know when you can't hear it anymore, okay? Excuse me.
Mm-hmm. I don't hear it anymore. I don't hear it anymore.
Okay, we're going to do the same thing with here.
Okay. I don't hear it anymore. I don't hear it anymore.
Okay. So ear conduction was about twice as long as bone conduction, and you passed both of those tests. So cranial nerve number 8 is intact. Cranial nerve number 9. Now spinal accessory. So what I'm going to be doing is I'm just going to be checking your strength in your shoulders and your neck.
Okay.
So I just want you to shrug your shoulders against my resistance, okay?
Okay.
Okay, and now head against my resistance and against my resistance, okay? Cranial nerve number 9 is intact. Number 10 and 11, that's glossopharyngeal and vagus. I'm so sorry about that.
You're fine.
So what we're going to be doing is checking your gag reflex and your swallowing ability and the movement of the uvula in the back of your mouth.
Okay.
So I apologize in advance. Okay, you gonna open your mouth for me? Alright, say ah for me.
Oh.
Okay, there's movement. I'm gonna check for your gag reflex, okay? I'm sorry.
It's okay.
And then we're gonna make sure that you can swallow. Okay, so cranial nerves number 10 and 11 are intact. Are you okay?
Yeah.
Okay. And then 12 is hypoglossal. And we're going to be checking your tongue movement and making sure that it's symmetric and that you have range of motion.
Okay.
Go up, down, left, and right. Okay? So cranial nerve number 12 is intact. So next, we're going to move on to musculoskeletal. So if you can, we'll just make sure you're covered up and stand up. And I'm gonna have you we're gonna have you go left with your neck and right with your neck and up and down and back and forth. Okay? Then we are going to have you put your arms up, put your arms down, put your arms out, wiggle your fingers, hold your head. Okay? So you got full range of motion in her neck and cervical spine, full range of motion in her upper extremities. So now we're going to go up with your leg, out with your leg, up with your leg, out with your leg. Whoop. Full range of motions in the legs. Now we're going to move your toes up, move your toes down. Full range of motion in the feet and toes. I'm going to go ahead and have you bend over like this, and I'm just going to check your spine. Okay. And no abnormalities noted with the spine. Any pain with that? No. Okay. If you don't care, if you'll go ahead and sit down, I'm going to review the rubric and make sure I'm not getting too far off track. Okay. I'm going to go ahead and just inspect her overall appearance. So her shoulders and iliac crest appeared symmetric both standing and sitting. We're going to check range of motion in your TMJ. So if you'll move it forward and back and left and right. Okay, full range of motion in your TMJ. Did you have any pain with that?
No.
Okay. And we're gonna go down, back, side, side, okay. I'm gonna go ahead and have you push up against me. Alright, and put your arms up. Pull against me. Push against me. Okay. 5 out of 5 strength in the shoulders and the upper extremities. Full range of motion with TMJ in the neck and upper and lower extremities. Go ahead and have you spread your fingers apart. Don't push them in. Okay, 5 out of 5 with her fingers. Go ahead and grasp my hands. Okay, 5 out of 5 strength. Gonna go ahead and have you push out. Okay, push in, push down, and push up. Okay, 5 out of 5 strength in lower extremities. I'm gonna go ahead and feel your muscle tone here. Your muscle tone is symmetric and firm. Muscle tone is symmetric and firm. I'm gonna go ahead and check your reflexes.
Okay.
So I'm gonna start with your brachioradialis. Just try to relax for me. Okay, 2+. Oh, I'm sorry.
I'm sorry, my gown is stuck.
I did your bicep, your brachioradialis. Your bicep was 2+. Let me do your brachioradialis.
Okay.
Okay, 2+. And then we're gonna do your bicep or your tricep. So just let me hang on here and relax it. And 2+. And do that one more now. Okay, we're gonna do your brachioradialis first this time.
Okay.
2+. Then we're gonna do bicep. Try that one more time. Okay, 2+. And tricep. Just let me have it there. Just relax it on me. 2+. Okay, I'm gonna go ahead and do your popliteal. Okay. That's better with 1+. Let me try one more time. Okay, 2+. 2+. And if you can, if you'll go ahead, stand up for me. We'll do your Achilles. And the other one. Okay. I'm gonna sit back down for me. I'm gonna go ahead and check your Babinski's. Here, sorry.
You're good.
Put negative for Babinski's. And negative for Babinski's. I'm gonna go ahead and check my paper again. This will be my last check with my rubric. Okay, so I jumped way a line there. So, I'm gonna go ahead and have you check your fingers. I don't remember if I had you check your fingers or not. Okay. So I'm thinking that completes our range of motion and musculoskeletal. So if you'll go ahead and stand up for me in the last portion of it. So if you'll just walk to the wall and then turn around and just heel to toe walk back to me. Okay. So her gait appears steady and balanced. Go ahead and close your eyes. Okay, and her Romberg test is negative. So I already checked your reflexes, which I shouldn't have done until the end. So I'm going to go ahead and have you sit down again. And I'm going to draw a letter in your palm and just let me know what it is.
Okay. A. O.
Okay. And then I'm going to have you put an object in your finger and let me know what it is.
The coin.
Okay. And then put one in your other hand.
A paperclip.
Okay. So then you can open your eyes now.
Okay.
Next thing we're going to be doing is we're going to just be checking your soft touch, sharp and dull touch. So this is going to be dull and this is going to be sharp.
Okay. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Sharp. Dull. 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 Sharp. Sharp. Dull.
Okay. I think that's everything.